Okay. Good afternoon. I would like to introduce the faculty for epidemiology component today. She is Dr. Kanagalakshmi, working as an associate professor from Community Health Department. Today she'll be handling the introduction to epidemiology component.
Thank you, Sonia. Good afternoon, everyone. Today you will be starting the new session, which is an epidemiology. It has totally 13 sessions. And I will be doing the introduction to epidemiology today. I hope you are able to hear me. Yes. Okay. These are the things we'll be looking into it today. The definition, the components of the epidemiology, purpose and use of epidemiology, the history, timeline, and epidemiological methods. So what do you mean by epidemiology? The definition is the study of frequency, distribution, and determinants of health-related states or events in a specified population and application of this study to control the health problems. I just repeated the study of frequency, distribution, and determinants. These are main three components: the frequency, distribution, and determinants of health and related states or events in a specified population, and this application of this to control the health problems. So the study means it's a collection and analysis and interpretation of the health related data. The signs concerned will be the morbidity, mortality, or also it can be the good positive health. The epidemiology is a basic science which deals with the goal of improving the health of the population. The main aim at the end point, we need to know that the population is healthy. That is the main purpose of this epidemiology. So this word comes from the Latin, which is epi is upon, and the people, and the study about the people. We'll actually go through the definitions and the epidemiology initial part, and we'll give a small break where if you have any doubts, you can go with it. And as I said, it's the frequency, distribution, and determinants. Disease frequency. How many? This is what we need to know. If it is a disease or a disability or deaths, it can be anything which we wanted to study. We can even need to study about the vaccination status, or you may need to know what is the nutritional status. Anything which we wanted to study will be an event. That is a health related event. And the frequency means how many. It can be either a percentage, it can be a rate, how we wanted to express this. Usually the examples for these are the incident rate, prevalence rate, birth rate, death rate, vaccination, proportion of the people who are taken vaccinations, how many people are having diabetes, the prevalence, all these will be included into the disease frequency. And why does it need to know? It can be different in different people, different population. So it will be helpful to find out what is the distribution among the other groups. So the next is the disease distribution. The disease distribution, we wanted to know how it is in each community, how it is distributed, who has more, where it is more, when it happened, the same year, was it different, or it was different in 1940 and it was different in 2000, and what is it going to be in after 5 or 10 years. So when you look into the example of the world map, which is shown there, the red one shows the high number of cases of lung cancers. The mortality rate per 100 million in both the sexes. It's actually more in the United States, in Canada, North America, it has been more, and even in China and Russia. And when you look into the blue one, which is the annual tuberculosis incidence, which is a communicable disease. Here you can find out it is very minimal in the American countries and states, Canada and the Russia, everywhere it is less. Whereas in India and Africa, you can find out the difference that it has been more. So this distribution, you can find out what are the causes can be because of this. So this distribution will give us to the idea of what is the determinants of the disease. So again, the third one is the disease determinants, factors that bring about changes in person health. Now we know how much is the difference and what is the group that has the problem. And then we wanted to know why and how does it happen? What are the factors which influence it? And this part is actually the analytical epidemiology. So here we need to prove it, why it is happening, how it is happening. And with that, we can come to a conclusion if we can do any intervention or a health program for that particular disease. And will it be useful? How we need to do it? All these things can be done in this stage. So why do we need to do an epidemiology? What is the purpose of it? The purpose, as I said, the end point is the prevention of disease and promotion of health. So how do we do it? We collect all the data and see what is it from the, interpret it. And from that data, do it at different places and make sure that it is consistent of the epidemiological data. Once we do a study, at one point or one population can be having a problem. And we can attribute to that reason. We have a hypothesis. For example, we think vitamin A deficiency causes the night blindness. And if I find it out in one place, it has to be there in different places and different settings. So that hypothesis is the vitamin A deficiency causes a night blindness. And the consistency is it has to be done in different areas, different places to make sure the same results are there in the different places and you are able to justify it. And the next point is it should be taken as the point where we can come about the preventive measures. We can find out which group is having the problem. Is it if we give it a intervention, suppose you give a vitamin A supplements, if it is given in a childhood, whether it is beneficial or if you give it in a later age and they are old, will it be beneficial? When the changes starts, when it will be beneficial, how to give it? Can it be given along with the vaccination or we can give it when they are born or whether it can be in the hospital settings, whether it is in a door-to-door setup. So all these things, what are the possible methods and how can we do it and which one is efficient? All these things can be done only by doing a study or epidemiological studies. So does anyone have any doubt till this one? The definition and the purpose of doing an epidemiology. You need to check if they are able to hear. Okay, then we'll move on to the uses of epidemiology. Are you able to hear? Yes. Okay. So why do we need slides? What are the slides? Yeah, you are able to see the slides? Okay, we'll continue. The uses of the epidemiology. The uses is the first main reason is we need to know the causation. What causes a problem? From good health to the ill health. What are the factors which influence it and what changes happens? The main reasons we attribute will be either a genetic factor or an environment factor. Genetic, we all know that it can be any genetic issues which can be transmitted from the each generations. And the environmental factor, it can be the surroundings, which can be the schooling, it can be the house setup, whether it was over congested, the population around that area. Is it clear now? Are you able to hear it clearly?
One person is clear means
You can go ahead.
because others may be having some
Problems. Okay. And the next will be the natural history of disease. This natural history of diseases, it is how the disease, when it starts from the good health, how it influences in a person and what happens till the end. So we'll take cancer here as an example. When a person is diagnosed to have cancer, it would have already gone through some stages. Some may be on the early stages, some will be on the late stages. But until then, when you diagnose it, between the gap, there would have been a subclinical changes right from the time the person had the disease and the time when he was diagnosed. This subclinical changes, what would have happened? And what is the earlier stages that they will come to us? Maybe he would have had a cough if it was a lung cancer, or if it is a breast cancer, then he could have palpate a nodule, or it could have been an ulcer. But till then, the changes will be the subclinical changes. And once the clinical disease is established, what happens? Is there an intervention? Can you treat them? If you treat them and they are getting better, it will be the recovery. Or if it's only the just palliative and you can give, and it will be the death. So this not only applies for the non-communicable disease, it also applies for the communicable disease, where most of the time the things would have been the recovery unless the clinical disease has been well established and the treatment is out of reach. And then the next one will be the distribution of the health status of the population. How many are having good health? How many are among those who are diseased? How many are adults? How many are children? And it can keep on describing it. How many have access to the health facilities? How many have access to the sanitary issues? How many have toilets there? How many are educated? How many people would have gone to school? How many are working? The occupational disease, how many are working? How many places they changed? All these, the description of the community can be done through the epidemiology. And also the changes over the period of time. If you look at this graph which is given there, the blue lines shows the injuries, and the lighter blue or the greenish color shows the communicable disease, whereas the red one is the non-communicable disease. If you see it from 1990 to 2020, the disease as it has progressed, the injuries have actually increased a lot. The communicable disease, because of all these epidemiology studies and finding out new treatment modalities, the communicable disease has actually come down. Whereas the deaths, all these are the deaths, and the deaths because of the non-communicable disease have actually is going up. So when you look at it, you can see the trends which is actually happening in the real world now. So I think you would have got the idea what are the uses of the epidemiology till now. And let's move on. What was the history, how this epidemiology idea started and how it keeps going on. Initially, they thought the disease actually is because of the supernatural causes. It's because of the sin they have done. It's a God's curse or someone else's curse. And this is what the idea was going on for everyone when it started. And they even thought if they would have committed some sin, that is what the karma is, they would have got the problems from them. Then the theory of humors was that it is not just the sin or what we have done, it must be some things which keeps happening in the world, that the fluid secretions or something is causing the disease. And then came the miasmatic theory of disease. They said, no, they're not just like that. It can be the air which is around. There is some air, bad air, which is causing the disease. And it was very late, till around 18th century, where they found out, no, it's not all these things. It is some infection. It is some organism which is causing all these disease, and which is from there only it keeps transmitting. And then came the Koch's postulates, where they found out how we can say because of the infection only, in the organism only, you got the disease. So there have been a different changes and ideas, and of late, in only this 19th century, they have come to the modern treatment, or the thing saying that the infections are caused by organisms, and how it is transmitted, how it can be prevented. All these things has been developed. So we'll just go through the slides and see how the epidemiology has been developed, and how each incident has got them the idea to develop the epidemiology. The initial things which would have happened is the census. The census, it's a procedure of systematic acquiring and recording information about the members of a given population. This was the first thing they have done earlier. This is the initial one which they have documented about the population. The population studies, the literatures, if you go back, it says in 800 to 600 BC in Rig Veda, there has been some reference saying that population count was done. And slowly the next thing, Atra Shastra in 3rd BC shows a collection of population statistics. Basically, those days it was done because to have a taxation policy, how much tax to be collected from the population or the general public. That is why the numbering was done. They have gone around seeing how much of agriculture was happening, what was the income among the population, and then they had a record of it. And when the Mughal Emperor Akbar was there, he has done a proper census about the population, industry, the wealth they have, and all these has been there. But a proper census came into the routine work only in 19th century. Only then the census has been started in almost all over the world, and in different times of the 19th century. Even in India, it was in the 19th century when they started. And the father of the medicine, Hippocrates, he was the first epidemiologist. He was the one, for each disease, he found out what was the cause for the disease. He had a clear observation of the patients, and he made sure what all happened for the person, what are the changes which happened, and what he was exposed to. All these things he documented, and he wrote a book of 70 volumes about the diseases he seen. So he has emphasized that detailed observation of the patients and accurate record keeping. He has insisted about the record keeping even then. And the idea of the disease may be associated with the environment, and it can be the air, fire, water, and earth. So he was the first one to say these environmental factors have an influence on the person to get a disease, which we still follow. And then there was a long gap in between. And after a long time, in 15th century, Fracastorius, he was the founder of the epidemiology. So he said, no, there had been something which has been implanted inside the person to get a disease. So he got the theory of contagions, seeds of disease, and he has found out that epidemics, basically those days the communicable diseases was very high, and there has been lot number of epidemics happening then and there. And he found out that there was some invisible particles which has been transferred from one person to another to get the disease. And it may be from one person to another, or it can be from the environment. And he was the one who has worked with syphilis, typhus, and plague. And he has said the transmission of syphilis is by sexual contact. Though he has said all these findings, he was not able to prove it. So the regular idea was of the miasmatic came into the thoughts. The next person who has done lots of work on demography, he is John Grant, 1620 to 1674. He went to the parish and found out all the death records. He looked into the death records, collected all the informations with that. And he has wrote a book, The Natural and Political Observations mentioned in the following index and made upon the bills of mortality. Mortality is the deaths, with reference to the government, religion, trade, growth, air, disease, and the several changes of the said city. So this is the book he has written. And in that book, he collected about all the details of the deaths. And along with that, he has collected about even the births with them. And from his book, the salient points which they have found out is the large number of boys were born than girls. And mortality rate was actually more in autumn. Autumn is the season where you can have flu-like symptoms. So influenza, everything was more, and the death rates were more. And some diseases and casualties keep a constant population, whereas some others are irregular. Irregular is when there is an epidemic, there may be more, like cholera and typhoid, there the death will increase, and then there will be some time where the death is low. And acute and chronic causes of mortality. There are some reasons where the disease would have been for a long time and they had a death, or the disease was small, they just got the disease and the death happened immediately. He also found out the rural and urban difference in mortality rate. The rural mortality was less and they had a long life than the urban in some cases. And again, after some years, James Lind, he did a study on the sailors and scurvy. We all know vitamin C deficiency will cause the scurvy. And how they found it out? They all found out the sailors were having a disease, the swelling of gums and knee pain, leg weakness as they were sailing. And when many people reported that, many sailors, when they go for a long travel, they get the disease. It was actually, it was documented. And this James Lind wanted to know why it happens in the sailors. So he went through the abstracts. This is what we need to do when we do a study. He went for a systematic review of abstracts. He went through the papers which has been written by others about the scurvy and found out what was it and how many people got it. All these reports he has got it. And then he has gone and spoken to the naval surgeons. From them, he collected the information and he went on a travel. As a second phase, he went on a travel. And then from those who got, 18 people have gotten the vitamin C scurvy disease. And he decided to give 6 different type of treatment. One was oranges and lime. One had apple cider vinegar, and another was an elixir he has prepared earlier. So like that, he grouped 2 people together, and then he kept trying different medicines for the 6 groups. And after 3 days, he realized that the person who took the lime and orange, that vitamin C, has got better. Though he was not able to say that it was the vitamin C, he found out that those who have this gum swelling, if they are given the orange and lime, they will become better. And the other 5 groups, which he has tried with different treatment, didn't get better. But unfortunately, because the numbers were very small and he was not able to prove this when he was in the land, it was not accepted. When there was lots of opposition, the political decisions was not being able to made. They said they can't store so much of orange and lime when they go for a sailing. It was not accepted. So they made it a condensed syrup. They heated it, boiled it. And this vitamin C, when it was heated, it got destroyed. And he was not being able to prove it at that point of time. And then the Daniel Bernoulli. So you all know Bernoulli was the one who invented the vaccine against smallpox. So he was the first person to say that if you put the smallpox virus in. He was not able to say it was a virus. He was said that if you put inoculate the material into the another person, from the infected person, if you take it and inoculate to another person, then the person will get a lifetime immunity. And he was actually a mathematician. So what he did was he demonstrated a mathematician model to show the effectiveness of inoculation in protecting against chickenpox. And he was able to prove that if you do it in the childhood, their life expectancy was more. So this was the first changes which was brought into the treatment. For the treatment's sake, the vaccine came up, and he was able to prove that if you inoculate at birth, increase in the life expectancy. And another person in Danish, Faroe Island. So there was an outbreak of measles there. And when this Peter Ludwig Panum studied the cases among the epidemic of measles, he found out that not everyone get the disease at the same time. When they go and see a person with measles, the new person gets the disease after a short time. So he said that there is a time interval between the time of exposure and development of the rash. And he also said the person has gone and seen the other person. So it is by the direct contact. And it is not the air or which comes. The Meyer-Smart theory doesn't apply here. And he said it is very infectious. The moment the person sees and comes, he gets the attack. And when another person goes and sees the second person, he gets the attack. So it is more infectious. The person, whoever sees a person with measles, are getting infected. And he also said, once they get the disease, they don't get it for the second time. So they are getting a lifetime immunity after the first attack. Those who survived the first attack will be protected against the disease. So these were his findings. Though he didn't name them separately, the first point, which there is a time interval between the time of exposure and the development of rash, is the incubation period. The person-to-person transmission, he found out how it is transmitted, and the secondary attack rate was being established. All these terminologies was being found out by the Peter Ludwig before. And then the John Snow, where you all will be knowing about him, the father of the modern epidemiology. So when we talk about John Snow, it is about the cholera. So John Snow was actually working in the public health system, where he found out that there was a lot number of cholera deaths happening in the London. And when he went to find out what was the reason for the cholera deaths, he found out it is mainly because of the people who drink water from the supply. There were 4 or 5 suppliers, and the main people were the Southwark and Waxel company and the Lambeth company. The deaths were basically from the 2 places. And he also went around finding out the deaths, which is because of cholera, and found out what was the water supply they get. And he found out there was clustering of cases among certain areas. And there was even a student who was living in a different locality, but went to a school which gets the water supply from the same tank. So like that, he was able to describe the population who were affected by cholera and had death. And this thing, tracing the source, was done in 1848. And again, when there was another cholera epidemic in 1854, at 1848, he has told out that because of the water supply and the 2 water pumps, which was from the Thames River, it was near the place where the sewage was actually let out into the Thames River. Those days, the sewage was also let into the river, and the water supply also was collected there. So these 2 pumps were nearer to the place where the sewage was left out. After he has raised a problem that it is because of the water supply. One company, that Lambeth company, has changed the location of the water pump to a different site. So in 1854, when again he did it, that time he did a comparative analytics survey. He found out that water supply sent by the Southwark Vauxhall company is still contaminated with something. That's why there is an increased death rate, and the other company has actually come down. So you can see the map there in the bottom where it shows that pump A, pump B, pump C, and the clustering of cases around it. So he found out that pump in the Broadway is the main place where many people are contaminated. There are many cluster of cases around it. And so he went and took away the handle of the pump. And then after some time, he found out the number of cases of death because of cholera had come down around that area. But he was not able to come to though he had a strong evidence against the water supply, the political issues in those days, he was not able to succeed with the recommendations for the water. At the same time, in England, there was another person, William Farr. He also was doing a study on this cholera. And he also has found out it is the water contamination which is causing the causes for the cholera deaths. And he was a medical statistician who has gone around collecting the data. And the data he collected was from the mortality. And because he was able to convince the government at that time, they formulated the Act, Liverpool Sanitary Act, which is as a prevention method to help the community to have a decreased incidence of cholera cases. And he developed a system to record the causes of death. And from the causes of death, he has even compared between different occupation and found out certain occupation are at the high risk of getting diseases. And then Louis Pasteur, he is the father of the microbiology, the germ theory of disease. And he said that it is not randomly anyone gets a disease. It is because of the organisms. The organisms will grow in the human body, and that develops and causes the disease. So it's the germ that causes the disease. And he has actually worked a lot in vaccination, and he has found out that boiling, heating can kill the organism in it, from where the pasteurization of milk and all has been developed. And sterilization, he said, under high temperature and high pressure, if you heat up at either a bottle or container, it becomes sterilized. And he has done a lot of work in sterilization and also a fermentation, how to grow an organism. So all these things are his inventions. So as Louis Pasteur has come up with this idea, the earlier thoughts, it is a supernatural cause for the disease, the karma and all has been disproved. And after his inventions, he has found out that the tetanus, puerperal sepsis deaths has come down. So he was able to isolate organisms in each disease. But again, there was a problem. Certain groups, the cause may be 2-3 causes. So they were rejecting it until the Bradford Hill. He is from 1897 to 1991. He is actually a statistician. He worked as a statistician in the study, which is considered to be the first clinical trial, which is use of streptomycin in tuberculosis. So this trial, he was a statistician basically. And they have found out streptomycin was effective in treatment of tuberculosis. But he had to say why he says that it has to be effective. So he formulated the criteria for establishing a causation. Just because one person found out that it is effective, we can't accept it. So how do we accept it? The certain problems are caused by certain organisms. And also he has done extensive work on death rates from lung cancer by number of cigarette smoked. So he went around getting the details from British doctors. Are you able to see now? You are able to see the PowerPoint? The screen is blank. You can see very well. Okay, so he has done a prospective study. He went around asking for how the number of cigarettes the different people smoke, and then he has followed them up to find out if they have developed the lung cancer. And he has established that smoking can cause lung cancer. And again, the problem which he found out was not only smoking, there can be other diseases which can cause the cancer. So the problem starts that the political acceptance was actually less when he came out with the findings. So this was the criteria for causation. The number one, temporal association. Does the suspected cause precede the observed effect? So the temporal association is the person has to be exposed to in case of measles, we'll take a measles example. The person has to be exposed to the measles patient to get the disease. So the suspected cause is exposure to the measles infected person and getting the disease. Similarly, in the case where the smoking causes the lung cancer, the person should have been smoking to get the lung cancer. So the suspected cause has to be there before the observed cause. And if it happens, it can be incidental also. So the next point, he said that there should be a strength of association. There must be something strongly saying that, no, this is only causing the problem. How do you say? We measure it. The relative risk. We say how much is it associated. If suppose the smoking causes a cancer, how high is it associated? They have to say if a person is a smoker, he has 3 times higher chance of getting a lung cancer compared to a person who is not smoking. So the relative risk has to be high. It's not only the smoking which causes a cancer. It can be the place he worked. It can be a passive smoker, or there must be having a smoke kitchen. All these things can also cause us a cancer. But then to say smoking is the cause for the cancer, it has to be a high relative risk. We have to prove that it is 3 times higher than the other group to get a cancer. So, and this is what we say, it's a dose response. And not only dose, how long they are exposed. Sometimes it will be just one contact, as like in measles, or it has to be for a long time. They have the lifestyle diseases like diabetes, hypertension. It's not just the sedentary life for a day or two will causes the lifestyle disease, but it may be for a longer duration. How long it had to have happened. If the person is maintaining a wrong posture for a longer time, he will get a back pain more than a person who just sits for a smaller time. So and these are the things we need to say that for the strength of association. And then the specificity of association, one-to-one relationship. Is it the cause and the effect? It is only for this, or it can be for many other things. Like lung cancer. Here, the smoking, it's not one-to-one relationship here for the cause and the effect. Whereas from measles or for the cholera, there the water, drinking the water, or the one-to-one just going and meeting a measles patients can cause the disease. So it's a one-to-one relationship is the specificity of the association. And consistency. If suppose I do the findings in our place, and again it is done in a different setting, it has to be reproducible at that place also. It should not be like one person seeing a measles patient causing a measles disease is there in the southern part, and if it is happening in a northern area and it doesn't happen, it can't be accepted. So we can't say that just direct contact with the person will get measles. So the consistency of association is how many ever times you repeat it, in how many ever different methods and how many ever different settings. It should be the same wherever you are done it. And biological plausibility. Biological plausibility is it has to be there should be evidence that biologically it can be happening. The credibility to the association. So if you take measles, you can prove that the measles enters into the human body through the nasopharyngeal secretions. It goes into the body, it multiplies there. You will be able to do a culture and develop it, and then it keeps multiplying. So this is called the biological plausibility. You will be able to give support your finding. And coherence of association is, it's a known fact that they are always relevant. Now, initial part when they established certain things would have not been accepted, but now as they keep repeating it, the coherence in known facts, that has to be found out to be relevant here. So as we went through from Hippocrates' time, 460 BC, the epidemiology kept on supporting. It started emerging in 460, but then from 17th century, there were a lot of support systems and many people found out new things. And then from there, they have found out that it has to be taken up as a separate subject, as a discipline in the public health system. And from 1940s, it has been developed. So we said we have to see what is happening. The definition is frequency, distribution, and determinants. Frequency and distribution will come under the descriptive studies. We can just go describe the population, see what the group of people who are having it, and describe them and find out what is happening. Whereas to find the determinants, or where a treatment has to be given, an intervention has to be done, there it becomes analytical. You have to try out something and find out if it is effective. That is the place for disease determinants. So all throughout, with the development of the histories, they found out all these things have developed and come up. What they found out, what is the event, what happened actually, what is the size of the problem. We'll just take the cholera epidemic in London and go through these things. What is the event? The main event was there are number of deaths, increased number of deaths at some point of time because of happening because of diarrheal intestinal issues, and they had deaths. So what was the magnitude? There was an increased number of deaths compared to the other diseases. Where did it happen? It happened within the city limits of the London. When did it happen? It happened throughout that year. Who was affected? All adults and children, everyone were equally affected in this group. Why did it happen? That is where he started finding out why did it happen, and found out the people who are drinking the water from that source has got affected. Here he has found out, compared to the group who didn't have the water supply in that area, the death rate is high. So it must be the water which is causing the death. What can be done to reduce this problem or consequence? So for here, it has to be change in the water supply. Here comes the public health interest interventions. How can it be prevented in future? Future, it can be prevented. Either the water supply has to be changed. There has to be made sure the water system is better, and the sterilization or filtration has to be done. So all these things will prevent the cholera deaths in the future. What action should be taken by the community? The community should be educated so that they will be heating the water and making sure they get a good drink of good water. What resources are required? Here, the intervention, we said the health education has to be done, the filtration has to be done, the supplier has to filter, the consumer has to boil the water and drink. So resources, here we need resources for the health education, and we have to make sure the water is filtered. We have to have control checks at various points to make sure there's some water supply doesn't have much of the organisms, and these things has to be found out. So what are the money, the human personnel, resources which is needed for that? So the and time allotted, how long it will take. Will the same person be able, the public health person who's looking at some other enumeration work will be able to do this? So all these things are the resources which we have to find out. And once you find out the methods which implementation, if you want to implement, what are the difficulties that can arise? It can be a political will, or it can be the person whom you are going to address is not highly educated, he's not able to carry out the work. The person, the community has to be educated first, or it can be a population where they have a different culture. They are not able to accept the cultural issues there, and how to overcome it. There may be some leader in the community where you can contact and improve. So all these things, see, when you come up with a plan for the public health interest or in a hospital setup, any things which you come up, so these are the things you need to know when you come with a interventional program. So the main thing is the event, how big it is, and where it happens, when it happened, who's affected, and what is the intervention. It can be even a disease. If you just take it as a disease, and a clinician, it has to be, they have to find out what are the methods, whether medical treatment is better, or you need to go for a surgical treatment. If it is surgical treatment, how to go about it? Do you have the facilities for that? What are the new things you need to buy, or who are the medical persons you need to recruit to do that surgery, and how will you get the cases, how will you operate, how will you see that? If suppose you do it in your hospital settings, will it be feasible to do it? So these things are the important things which you need to find out before starting up new things. And I think I have covered most of the introduction for this epidemiology. There are 2 more sessions on this epidemiology initial topics, where to next time we'll be going through the how we can measure it, what are the things we need to measure. Is anyone having any doubts? Actually, the books, the main basic book is the Park for the community medicine. And the next one, I think, which has been recommended for you is the David Lilienfeld Foundation of Epidemiology book, which I don't know whether you all get a copy, but that is the another recommendation which has been given by the course person. The basic epidemiology by WHO, that is another book which gives a basic details, which is very easier to understand. So these things you can have it for epidemiology, whereas the other books can be referenced. This Rothman, Kenneth and Rothman epidemiology book is actually a reference book, and the causation and causal inference and all, you get a lot of materials from the online. You can go through about the history. When you read about these people, just going through the history, how they have invented it, how they find the new findings has come up, would have been very interesting. And if you go through the history, just go through the history in the Google it and find out. Even tomorrow, you might be able to find out something new. Look at whatever you look out, whatever happens, just think about why is it happening? How is it happening? Who's happening? Accidents. We walk around, go in the road. Suddenly one accident happens. Who gets hurt? Okay, it's a young person. And the next day, maybe a young person. First day also, it's a college going student. The second day is also a college going student. Okay, they are exceeding the speed. That is why it is happening. They don't obey the rules. That is why it is happening. Mainly it is in that age group, which is younger age group, who doesn't follow the traffic rules and get into the accidents. So what can we do about it? Okay, we can bring about some changes. Either do a health education in the college level where we emphasize on the safety, and then we can even come up with some laws, helmet use, speed limits, and then we can come up with some interventions like speed breakers. Yeah. So what are the issues when you do it? How feasible it is? Which one will do first? Whichever is cost effective, where you don't need to have a lot of human resource and lot of money. So that will be used first, and you'll compare between 2-3 methods and find out which is efficient, and you'll do it. And then there may be some problems in implementing it. What are the problems? All these things are all part of epidemiology. So you just need to find out when you are going into a hospital setups, any small things which is happening, just collect it. And then you work on it, why it is happening. What are the reasons? Talk to people who works with that, like how they went for the lint, how he went and talked to the person who are the naval surgeons. He spoke to the marine surgeons. He spoke to them and found out what are the cases, how are they presented. Like that, when you talk around, so when you get, you'll be just going through in later on in the epidemiology part. It can be either numbers, you'll be able to count it in numbers, or you'll just talk to people and have a qualitative. So that's a qualitative study where you won't be able to tell in numbers, but you can collect it from them. So you just need to do, you can do it in the day-to-day life. Anyone having any doubts? Okay, thank you. So we will meet next week with the next part of the epidemiology. Thank you.